heard me for now, so I won't make any introductory remarks. I'll just start with taking any questions you'd like to ask.
Well, first off, just summarize for the viewer, what are these roundtables really all about?
It's a chance for legislators that are all around the state to have small groups together to ask whatever questions they would like. And so we purposely aren't doing big town halls because it's a chance for legislators who are ultimately going to have to vote to dig in and begin the kind of the detailed look at the plan.
What are you hearing from a lot of legislators? It seems like there was a lot of skepticism in the room today.
This is healthcare, first of all, is a complex subject, number one. Number two, because it's tied, in some people's minds, because it's tied to Obamacare, it becomes very politically contentious. And so what we're trying to do is to separate out kind of the fact from the reality, and that this is an opportunity for Tennesseans who don't have health care coverage to have that. At no cost to state government, and long-term with a plan that we think will actually take down healthcare costs, which, regardless of what political party you are, should be a concern for everybody.
All the lawmakers are going to be coming back next week for the special session.
Right.
Can you kind of give us an idea of what all is going to be happening over the next couple of weeks?
Sure. So the special session will be kicked off Monday afternoon, February 2nd, and kind of with a joint meeting of the House and Senate where I'll come in and make a brief address, and then they will start their committee processes in the House and the Senate, which we obviously hope culminates in a vote on both floors in favor of this. So we don't know how long that process will take. Right now it's designed to be a week. We'll see if you know, right now, because we've never done this and it's a fairly complex situation, it's hard for anybody to project exactly how long it'll take.
Have you settled on a Senate sponsor yet?
We should have an announcement on that pretty soon, next day or so.
I know you've said that, or it's been said that Insure Tennessee isn't really Obamacare. Does that mean that you really need the legislature's approval for it?
Well, it does, in the sense of, I mean, here's what I'm saying. So I want everybody, there's a lot of things in the Affordable Care Act that I don't like, a lot of folks don't like. I don't like the individual mandate. I don't like the fact that they didn't address cost control like they could have. What these are federal funds that are being made available to Tennesseans. By the way, they're also federal funds that are being paid for with taxes from Tennesseans right now. Right now, Tennesseans are paying tax for this that's going a lot of different places. What we're trying to do is come up with a system that takes advantage of that and addresses people who don't have coverage, but also addresses the long-term cost of health care, which everybody should be concerned about.
Guys, we have one or two more.
Can you just briefly summarize again those two
Sure.
options?
Sure.
There?
So there'll be two options for these are folks right now who are at or below 138% of poverty, which is basically they're making anywhere from $0 a year to up to $16,000 for an individual. The average person makes about $6,000 who would be covered. And so there would be two things. Over half of these folks are actually have a job, they just can't afford insurance. So they would be provided a voucher, which would allow them to buy into their employer-sponsored insurance. That's what we're calling the volunteer plan. The second that we're calling Healthy Incentives Tennessee, which would allow people to have insurance, but there would also be premiums and copays involved, which we think incentivizes people to make healthy choices, like not using the emergency room for non-emergency care when you have other providers available, like getting annual screenings, which are going to prevent, obviously, health emergencies, but also catastrophic costs down the road. So those are two plans: volunteer plan, a voucher to let people buy into their employer-sponsored insurance, and then the Healthy Incentives Tennessee plan, which involves premiums and copays with your insurance coverage.
And rewards for helping.
I'm sorry, with some rewards that allow you to minimize, if not eliminate, the cost out of pocket.
With all these roundtables you've been having, are you optimistic that you have the votes to pass this right now?
Well, we actually don't know that yet, and I'm purposely, the point of this, I don't leave these meetings saying, will you vote for us, will you vote for us, because there's still a lot to be heard. I mean, we're going to have a whole week full of meetings. We obviously, feel very strongly this is the right plan for Tennessee, or we wouldn't be going through this. But I think it's early for anybody to try to predict where the votes are going to come out.
Governor, has your experience negotiating for Tennessee over the past couple of years shown that at least in your opinion, that the Affordable Care Act is more workable and the Obama administration is more flexible than the state legislature has given credit?
Well, I mean, we've had some really intense negotiations back and forth, like I said, for almost 2 years. There are a lot of things we would like them to be more flexible on, to be honest, and we would like the Affordable Care Act to have been written differently in a way that we think could do more of the things that we're moving toward in Tennessee. But again, at the end of the day, we came back with a plan that I think is the right one for Tennessee, or we wouldn't be recommending it.
Thanks, guys.
Thanks, everybody. Appreciate you.